My name is Frances Angela C. Icot, your student nurse for today. I will be performing the written demonstration for giving the patient a bed bath, including shampooing, oral care, and back massage. First, I'm going to check the patient's chart for any limitations in physical activity to prevent discomfort and injury. And I'm going to assemble the equipment on the bedside stand or the overbed table so that I can prevent strain and conserve time and energy. Then I'm going to perform hand hygiene to prevent the spread of microorganisms. Good morning, ma'am. My name is Frances Angela Sibicot, your student nurse for today. May I ask for your full name, please? Your birthday? Can I check your ID band for verification, please? So for today, I will be giving you a bed bath, including shampooing, oral care, and back massage. I will maintain your privacy and comfort during the procedure, and please tell me if you feel uncomfortable. Identifying the patient helps verify the correct patient and procedure and prevent errors, and explaining the procedure to the patient alleviates their anxiety, reassures them, facilitates their cooperation, and prepares them for what to expect. Alright, now I will close the curtains around your bed for your privacy. And then I will adjust your bed into a comfortable height, which is in my elbow height, so that I can prevent back and muscle strain. Then I will also lower your bed rail so I can provide you a bed bath. Alright, now I'm going to put on gloves to prevent the spread of microorganisms. If the patient feels the urge to void or defecate, offer them a urinal or a bedpan so that we can prevent the interruption during the bed bath. Alright, first I am going to rinse your eyes using this washcloth without any soap to prevent irritating your eyes. And then I'm going to start from one eye, from the inner part to the outer part, to prevent the spread of microorganisms. The other eye. Right, now I'm going to continue washing your face. And then your neck. And then I am going to please I'm going to uncover your arms so that I can wash them properly. Right, and then I'm going to use this towel to first pat dry your face and your neck. And then place it underneath your arm so that we can keep the bed dry. Right. And then I'm going to use another washcloth and place soap. Rinse. Then I'm going to wash your arms first. And then your hands, between the fingers, and under your underarm. Right, and then I'm going to rinse the soap off using the other washcloth. In the same places on your arms and your hands, between the fingertips, and then between the fingers, and then on your underarm, And then I am going to pat you dry using the towel. And may I please wash your breast, your chest, and your abdomen, right? And I will put on soap again. Yes. I will maintain your privacy by keeping the blanket on. I will clean the breast folds and the abdomen folds so that we can prevent moisture and skin irritation. And then remove the soap using the other washcloth. And then I'm going to use the towel to dry you properly. I'm going to cover your arms now. Now I'm going to move to the other side of the bed. I'm going to put some soap first. And then expose or uncover only on your arms so that I can wash it properly. First the arms, and then the hands, and between the fingers, and then the underarm, and then I'm going to clean it with the other washcloth. And remove the soap. Then I'm going to pat you dry using the towel. And then I'm going to cover your arms again. And then I will raise the side rail on the other side, opposite side, for your safety. Then using this sheet, I will move you to the opposite side so that I can clean your back or wash your back. Okay, I will move you now. 1, 2, 3. Alright, and then I will keep your blanket on for your privacy and only expose your back. I'm going to pull your gown up here. And then I'm going to put soap. First, I'm going to put this towel underneath to create a barrier so that we can keep the bed dry. Right? We'll start washing your back and underneath so that we can prevent any moisture and skin irritation. Alright, and then remove the soap using the other washcloth. Now we're gonna pull your gown down and the blanket for your privacy. I'm going to remove the towel. Then I'm going to assist you to move to the back to the center. 1, 2, 3. Right? And reposition the blanket so that you are comfortable. Right. And then I will now remove my gloves and place any soiled linens into the laundry bag and clean the basin after to prevent contamination. Now I will perform hand hygiene to prevent the spread of microorganisms. And then I will arrange the equipment that will be used for the shampooing, oral care, and back massage. Then I will put on new gloves to prepare for the shampoo. Alright, I will first start by checking your hair for any problems that may need care. Alright, this seems to be no problems. And then I'm going to remove your pillow. Alright, and then I'm going to put a towel underneath and around your neck. And then I'm going to put a basin under the patient's head so that we can prevent any spills. And then first, I'm going to wash or damp the hair using water so that we can easily lather the shampoo. Alright, and then I'm going to put shampoo on my palm and mix and massage the hair and lather it. That we can lather the shampoo and we can remove any dirt and oil using my fingertips. Alright, and then I'm going to rinse the shampoo off with water. Alright, and then I'm going to remove the base. I'm going to dry the hair using the towel. And wipe off any excess water on the patient's face. Prevent irritation. Right. And then I'm going to remove the towel and the basin. And then I'm going to brush your hair to prevent any tangles. If possible and applicable, use a blow dry to dry the patient's hair to prevent discomfort. And then I'm going to place a new pillow and another towel so that we can prevent the damping the pillow. Yeah. Right. Now I will remove my gloves and place any dirty linens on the laundry bag and clean the basin to prevent contamination. And then I'm going to perform hand hygiene, prevent the spread of microorganisms, and put on new gloves for the oral care. First, I will have to adjust the patient's head of bed so that they can make it easier to brush the teeth and spit anything. Right? Going to adjust your head. Right? Please sit in. And then I'm going to provide a cloth so that we can prevent any spills and keep the patient dry. Okay. Then I'm going to provide the patient with a spit of water to moisten their mouth. And then get a toothbrush, put toothpaste. Then I will start brushing from the outside surfaces of the teeth. Then start from above and below, and then under on the chewing surfaces of the teeth. And on the inside surfaces of the teeth. Right. Then I will brush the tongue. And then I will move to the front in up and down motion to clean the teeth, the front teeth. Right. Now I will provide the patient with a basin to remove any excess toothpaste and water to remove any excess toothpaste also or bubbles, and provide with them mouthwash to for more cleaning of the teeth. Alright. And then I will remove the towel and then place you back in a comfortable position. Now I will remove my gloves and place any soiled linens directly into the laundry bag and any basin that were used to prevent contamination. And then I'm going to perform hand hygiene, prevent the spread of microorganisms. And then I'm going to put on new gloves for the back massage. First, I will adjust the bed into a comfortable working position. And then I'm going to go to the other side of the bed and place a side rail for your safety. And then I'm going to use this sheet to move you over to the opposite side. Alright, I will move you now. 1, 2, 3. Alright, and then I will only expose the back for your privacy. Right, and then pull your gown up. Right, and then I will place a towel under you to create a barrier between the bed and your back, so that we can keep the bed dry. Then I'm going to put on lotion and rub it between my hands to keep it warm. Then starting from the waist to the shoulders, I'm going to massage it, massage your back. and from the back down again, so that we can prevent any, so that we can promote a return of circulation and keep the patient relaxed. Please tell me if you feel any pain or discomfort so that I can ensure your safety and your comfort. Alright, now I will add more lotion to prevent skin irritation and keep the back moisturized. Rinse, keep it warm. Then now I will do big circles, starting from the waist again, up the shoulders, back down, that we can promote circulation. And then we will add more lotion, keep it moisturized. And then I will do the from the waist to the shoulder again, the big slides or sweeps. We will do the back massage approximately 4 to 6 minutes. Right, now I'm going to use the towel to blot or remove any excess lotion. Right, and remove the towel. Then I'm going to pull your gown down and your blanket, and I will return you to the center. 1, 2, 3. Alright, so that you can be comfortable. I will adjust your blanket. Alright, and then I will adjust your bed height. Then I will remove my gloves, place any soiled linens directly into the laundry bag, and to prevent contamination and perform hand hygiene. Alright. Are you comfortable or do you need any adjustments? Alright. Thank you for your cooperation.